Well, more than 17 million of you have been watching this YouTube channel since it started, and I've been saying the same thing over and over again, expressing to you the thousands of stories that I've heard from tens of thousands of seniors across the country in all 50 states now in the 25 years that I've been helping people with Medicare. But today, it's not me. I'm going to share with you what the HHS, that the Health and Human Services Office of Inspector General, has to say about the differences between original Medicare and a Medicare supplement versus Medicare Advantage, which is managed care. So this is not me. I'm going to not edit or stop this in any way. This is straight from the Office of Inspector General. Listen to what the profit motive is. Listen to how the denials of care work and why they happen only on Medicare Advantage. Here it is.
It's important to understand the basics of managed care and how it may affect you. What is managed care? Managed care is a healthcare delivery model and an alternative way Medicare and Medicaid patients can get their health benefits. In traditional Medicare and Medicaid, the government covers healthcare for seniors, individuals with disabilities, and others by paying healthcare providers that care for Medicare and Medicaid patients. In managed care, the government pays private health insurance plans to provide coverage for Medicare and Medicaid patients, and the plans pay healthcare providers that care for the patients enrolled in their plan. The government pays an insurance plan a fixed monthly payment to provide you coverage for healthcare benefits. In exchange, plans get to keep that full payment regardless of how much healthcare you need each month. If you need a lot of services in a month, the plan must cover those costs, even if it costs more than the fixed monthly payment they receive. Or, if you don't need very many services, the plan gets to keep the difference between the payment it got and the cost of those services. One concern is that when plans agree to cover the cost of your care for a fixed monthly payment, some plans might improperly limit your access to care to maximize their profits. If you get less healthcare services, the plan gets to keep a larger share of the fixed monthly payment. OIG work has found that some plans inappropriately deny authorizations for services or deny payments for services. This is called stinting on care, and these inappropriate denials can interfere with your timely access to necessary healthcare services. Also, Medicare will increase the fixed monthly payment when plans provide coverage for enrollees who may be sicker than expected. These are called risk adjustment payments and are designed to make sure Medicare Advantage plans are paid appropriately based on the health status of enrollees who may need a little more care due to significant health conditions. Some Medicaid programs make similar payment adjustments. One of the well-known concerns associated with Medicare Advantage is the potential to game the risk adjustment payment program. Some insurance plans may inappropriately receive more money than they should because they overstate how sick their members are. In some cases, plans may offer you a free health risk assessment and then use that assessment to make you appear sicker than you are, or diagnose you with conditions that you don't have or haven't received treatment for. So what can you do to protect yourself if you're enrolled in Medicare Advantage or Medicaid managed care? First, be informed. Read your plan's materials carefully and understand what is covered. For example, the Centers for Medicare and Medicaid Services publishes information to help enrollees understand the differences between being enrolled with a Medicare Advantage plan versus enrolling in traditional Medicare. Many states make similar information available about their Medicaid managed care programs. Second, don't hesitate to ask questions. If you feel like you're not getting the care you need, talk to your healthcare provider or call the Enrollee Assistance Line for your Medicare or Medicaid health insurance plan. Third, if you suspect your plan is stinting on care or not providing the services it promised, please report your concerns to Medicare or your state Medicaid agency. Finally, stay informed about changes in your plan. Plans can change each year, so review the annual materials for your plan closely. The American people deserve to know that the insurance companies receiving more than $700 billion annually in taxpayer funds are working to ensure you receive effective, high-quality care. Remember, you have rights and options to ensure you receive the care you deserve.
So when you're on Medicare, you have two choices to go. Original Medicare that you've earned and paid into your whole life, but it only covers 80% of your costs. So you need a Medicare supplement to go along with that. A lot of people say, I can't afford a Medicare supplement. So if they go into the Medicare Advantage, that means you're giving up your Part A and Part B for the contract year that you're contracted with that Medicare Advantage plan. They call the shots on what's going to be approved, and the incentive there, as they just pointed out, is to give you the least amount of coverage because they make more money when they pay out less for your coverage. Just understand that's the world that you're in. And if you're in that world, don't be there alone. This is not the time to do it yourself and try to figure out which plan is the best based on their national reputation. Are they gaining ground or are they losing ground? Are they expanding? Or are they not? Who do you know behind the scenes that can tell you what's going on with the insurance carrier? Who studies this stuff all day, every single day? And why not? If you had the benefit of somebody's experience like that, why not let them help you through it if it doesn't cost you a dime? Go through an independent broker. There's no reason not to. All the benefits are in your hands if you get the best experience to work for you. There's no reason to do it yourself. That's all I got to say about that.